What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason, probably not going to change. Another fan question. How do you handle the family member or friend that knows everything, that starts quoting medical terminology in some way, shape, or form? How do you handle the family member that is in the medical field and that knows everything? This is an interesting question because unfortunately I've been that family member. I've tried my best not to mention that I'm a nurse practitioner, but I always feel the need to give that information when talking to the provider so that we can have a professional conversation. Because you know as well as anyone else that when you're speaking to a non-medical person, you need to speak in a different manner. There are many terms that you would use that a non-medical person will not understand. So you have to spend more time defining things. You have to spend a little bit more time in walking someone through some of the pathophysiology. If you have a family member or friend who works in the medical field, works in the healthcare field, then that should make your job easier. The problem arises when that particular family member or friend starts to question your abilities, to question the medical team's decisions. I have two things that I would say about that. The first thing would be, do not create engagement or conflict. Do not feel the need to defend yourself if you and your medical team have come up with a specific plan. As long as you remain informed about that plan, whenever that medical person starts questioning what you're doing, you will have the information in front of you. You will have that information to arm yourself appropriately. The worst thing you can do is to create conflict in some way about who's smarter, who has the better decision-making abilities, and what's better or worse. Don't go down that road. As much as you want to, do not go down that road. The second thing I would say is, I don't think most family members and friends who are in the healthcare field are going to question your decisions. Most of the time, like me, most of the time when you introduce yourself as being in the healthcare field, it's so that you can have a professional conversation. The only other thing I would say in regards to this entire concept is that a lot of times, and I speak from experience, that when your family member or friend is working in the medical field, they have a very hard time relinquishing control over to someone else. And that is usually where the insecurities lie. That is usually where the fear lies, is in the inability to relinquish control. So if you can do your best to comfort them in knowing that everything is taken care of, 99% of your problems will be solved. I keep going back to this suggestion because it bears repeating and it helps you in every instance. Put yourself in their shoes. Why are they saying what they're saying? Why are they acting the way they're acting? What is it they're really getting at? Because 99% of the time they're not questioning your decision-making abilities. They're not questioning your knowledge. They're not questioning your care plan. They are simply expressing concern. And besides, if all else fails, simply ask them, what do they think should be being done? Ask them for their opinion. If they're that adamant and angered by what is or is not going on, simply be blunt and ask them, well, how can I make this better for you? What is it do you feel is not being done? And that usually solves almost 100% of your problems. because then they air their concerns, and you normally, in almost every instance, you'll be able to give an answer as to why something is or is not happening because you're already informed. Curious to hear what you have to say about this one. How do you handle when that family member or friend has medical background, is in the healthcare field, is a nurse, is a doctor, is a nurse practitioner, or a physician assistant? How do you handle them? Do you treat them differently? Inquiring minds want to know. As always, love hearing your comments. Drop me a comment down below. Thumbs up is always appreciated. Your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.